Welcome, everyone. It's really exciting to be talking about bridging the gap when it comes to diversity in medical education, because I feel like this is, quite a well talked about topic, but I think it's really important to reflect on what's already happened and what our next steps are really, especially when trying to promote student professional or student professor kind of dynamics in order to make that sustainable growth in the long term. So just a bit about me. I'm Naabil. I'm a third year, hopefully going into fourth year, medical student studying at the University of Exeter. And I'm also the founder of a non-for-profit which focuses on representation in medical education. And hopefully today I'll be talking about, what my journey has been so far, as well as what I've learned really about medical advocacy and representation, especially within a university context. If you have any questions, please let me know or just write it in the chat and I'd be more than happy to answer it throughout the presentation. So the first question really is, why do we need representation in medical education? I think this is a question that a lot of people do ask, and it has been a very well answered question. And, you go into the history behind medical education. So today I won't be going into too much depth surrounding that. I'll be talking about the very real world contemporary complications of what happens when we don't have representation in medical education and how that very much trickles into the NHS and into professional settings as well. So the first point is really, diverse research. So a case study includes, Our Future Health, which focuses on this genetic biobank of people from different ethnic minority groups. And it creates this huge kind of data cohort for diverse care and personalized care, which could very much trickle into, the NHS and personalizing certain forms of medicine for certain ethnic groups. And I think that's so, so important because we have an increasingly global and diverse population, especially within the UK, but it can very much be said for a lot of populations. So making sure that our diverse research is actually diverse means that students have that structure in place to be able to involve themselves in that research. And again, it impacts what future research is done and what kind of personalized care we can provide. Then competence. So looking back at students, I found that when you feel like you can't recognize certain skin conditions and certain presentations on people of color or ethnic minority patients, it means that they feel disempowered and they feel disenfranchised, really. You've done 5 years of medical education and you still feel like you can't treat everyone to the same capacity. So competence is a huge, huge impact of representation. And I think it's incredibly important in terms of reducing misdiagnosis as well. There was an incredible article that was written by Selma Gilman, who focuses on Lyme disease, especially on Black patients, and basically reported how a Black GP had seen a patient who had a darker skin tone and had not recognized that this patient was presenting with Lyme disease. As a result, that patient grew further complications, and unfortunately, they had a poorer prognosis compared to what would have happened if they had recognized the condition earlier. So again, they felt very disillusioned and they felt like they couldn't properly treat the populations that they were being faced with. And I think that is a challenge that a lot of medical students are currently facing now. We're creating a workforce of students who understand that there are differences in ethnic minority presentations, but are not primed enough to competently and confidently recognize those conditions when they see these patients face to face. So that's another huge reason why representation is so important. Then you've got inequalities. It was the Marmot Review that really inspired me to write this point, where essentially Sir Michael Marmot recommended that promoting equality in education was one of the huge steps towards progress when it came to addressing barriers that ethnic minority patients faced in healthcare. And these barriers include, language barriers, cultural differences, and discrimination, as well as the hidden biases that we can see with things like microaggressions. So addressing those inequalities through increased representation is so, so important, not only for patient care, but for when we record these health inequalities and we see what barriers are actually being posed towards these certain groups. Then you've got patient interactions. So it's been found through numerous studies that actually improving your cultural competency in the language you use with patients improves patient interactions dynamic and rapport. reports. So I think it's really important that we prime medical students to really improve that communication skill and to highlight the fact that people come from different backgrounds and not one size fits all model when it comes to interacting with different patients. And I very much think that this will address the communication inequalities that we've definitely seen since the COVID-19 pandemic, where you've got patients essentially using a different kind of language to what medical professionals are using, and highlighting the fact that, that jargonistic, non-jargonistic language within the medical profession needs to be addressed in order to bridge that communication divide between the medical and non-medical world. Then you've got concordance. By representation, I don't just mean representation in images or languages. I also mean representation in the workforce. And thankfully, the NHS is more diverse than it's ever been before. I think around 24% of the workforce is from an ethnic minority background, and more senior level positions are taken up by ethnic minority professionals more than ever before. So we are in a good place when it comes to the NHS, but more needs to be done. It's been found that the National Academy of Sciences actually found that Black men, this was carried out in America, they were more likely to agree to preventative health measures, including things like cholesterol screening, diabetes check, when they were served by when they were interacting with Black doctors. It's that level of concordance that we really need to understand, that people from ethnic minority backgrounds potentially do have that historical mistrust in healthcare professionals. And for them to be able to feel seen and heard and respected, they need to feel that sense of relatability to whoever is providing healthcare for them. Then we move on to mortality rates. This is something that's definitely a lot more, pressing and very concerning as well when we're talking about patient care. Representation and a lack of representation results in the death of patients. And it's a fact that I think a lot of people find it very hard to swallow, but it is something that we need to understand in order to push for this movement towards representation. We can just use the example of mortality rates, obstetric mortality rates, especially when it comes to childbirth. Black women are 5 times more likely to die in childbirth than their white counterparts, and Asian women are 2 times more likely to die in childbirth compared to their white counterparts. And numerous studies have highlighted that this is due to a lack of representation, that bias within healthcare, and especially obstetric and gynecology teaching, as well as an ill recognition of any adverse symptoms that the mother may be experiencing. So again, I think this is one of the most pressing and concerning stats when we talk about representation in medical education, as it does very much directly lead to patient deaths. And then finally, the environment, kind of going back to the classroom and case studies and looking at the medical student experience. I believe that when you highlight representation and when you very much encourage it within the classroom, it fosters an environment where students feel confident to speak up about any injustices they face, speak up about any injustices they've seen occur. It fosters a community where you can support one another in terms of making a change. For example, if a student feels like they're being discriminated against in the workplace, but they don't feel like they have those support networks in place or safety nets in place within the university, it's more likely that they let that instance of discrimination kind of go under the radar. And I think that's so harmful, especially for student mental health, and when it comes to uptake within medical education and the life beyond medical education. It increases student lack of well-being. It increases rates of mental health complications when you're in the workforce. So being able to address the issues that students are facing, especially regarding representation and discrimination from the very early stages of their medical education, very much primes them to become these confident and comfortable workforce members who feel like they can hold people accountable to any forms of discrimination. So I guess I'm going to move on to, what already exists. I think, again, I've done so many of these presentations which talk about representation and, why it's important, but I can very comfortably say I think everyone knows why representation is important. But what already exists? What structures are already in place that we can work with? So I've noticed that there have been 4 main structures that I've seen in place, which is literature, initiatives, networks, and organizations. And all 4 of these very much play hand in hand with one another in terms of encouraging students to take on their own initiatives and raise awareness about racial inequalities. These are the 4 main what projects I've really interacted with. So in terms of literature, you've got Mind the Gap by Malone McQuendy. This is a very well-known book that was carried out over, I think this over 2021, 2022. And he has essentially received significant attention, and it's being used as an educational tool, as it's one of the first of its kind in terms of highlighting racial inequalities in a textbook form, especially when it comes to dermatological presentations. And reading that book, I very much felt inspired to carry out my own organization, which is Skin for All. So again, you have that ripple effect, you have that domino effect when you've got literature out there that's carried out by students in terms of inspiring future students to carry out their own forms of advocacy and change. Then you've got initiatives. This was due to the COVID-19 pandemic, but White Coats for Black Lives very much took the data that came out of the pandemic and highlighted the fact that in America, the health inequalities, especially concerning Black professionals as well as patients, was incredibly stark and concerning. So they've brought attention to this phenomenon when it comes to representation. They fostered a new generation of medics through mentorship schemes, and they've supported Black medical students and professionals when it comes to accountability training, when it comes to bystander training, and when it comes to highlighting any forms of racial discrimination within the workplace or clinical settings. So they've been an incredible organization that have really fostered that idea of mentorship and support within an environment of people who potentially or historically have been marginalized. Then you've got networks. So this is definitely a lot more relevant to the University of Exeter, as I know that our dean was involved with the University of Leicester as their dean and was very much involved in this initiative called MedRace. And they focus on advocating for racial justice. They support minority students through mentorship. They conduct research and they engage with communities. So again, these are all incredible pockets of wisdom that we can take from other universities when it comes to promoting that racial representation through networks, and especially through student professional networks. I think that's so, so important. And then finally, you've got bigger organizations. So we've got the charity Melanin Medics that's currently working in the UK. And through their work, through mentorship, advocacy, and providing financial assistance, they're really working to bridge that gap, especially when it comes to attainment and uptake of ethnic minority students, especially Black students in the medical profession. So I think all four of these structures are so, so strong. And I think we really need to work with them and grow on the messages that they've already put forward when it comes to representation. Because there's no point, I think, in my opinion, there's no point in creating a whole new structure if it already exists. It's about collaboration and it's about networking with these other structures to make it even more stronger and sustainable than it was before. So moving on to the work I've done with Skin for All, I would very much categorize Skin for All as a network / initiative, which focuses on medical representation and why it's so, so important. So this is what Skin for All has done so far. So we've used language and images to highlight to highlight the racial inequalities, especially when it comes to dermatological presentations. We've guided patients, so we've included questions that non-medical users can read when they want to potentially guide a conversation with their healthcare professional if they don't feel like they have the confidence enough to do so. It's highlighting ethnic disparities. There are lots of essays and resources within the website that very much references post-COVID studies, which highlights the recognition rates, mortality rates, and management of ethnic minority patients. So whether you are a medical or non-medical user, that awareness is still being gained, and hopefully for medical users, that will inspire you to potentially carry out your own initiatives or learn more about the research that's being carried out currently when addressing racial inequalities. It's asked questions, with the whole purpose of the website for me, I think, is to get people to question current dynamics and biases in healthcare and the structures that are currently in place, especially between the medical and non-medical hierarchies. And through advocacy and presenting at different universities, I've been able to, I guess, sow the seeds of that questioning and that curiosity amongst medical students and non-medical students. And finally, continuing the momentum. Like I said, we're not starting from scratch. This isn't a topic that is it's fresh in the works. It's only just been introduced a couple of years ago. It's been around for ages. The movement has been around for ages, especially amongst the student populations. So this is just a way for me to continue the momentum of fostering, continuous growth where students can get involved in initiatives that include racial representation, and then hopefully create their own initiatives and lessons. The reason I mention this is because I think the whole theme of EduExe Festival is about, that transformative education. And I find that the transformation very much lies in trying to encourage students to take control of their learning and to work with academics and professors to change things for the better, especially within curriculums. So this has been my journey so far when it's come to Skin for All and what it's achieved. And this is very much a testament to why representation and initiatives around representation are so in demand and the impact it can actually have. So when I created Skin for All in June 2023, it had 6.5 thousand page visits over June to December, which I think was incredible. And it very much was a testament to how high in demand representation is and why that conversation needs to continue. Then I released a Times Higher Education article, which was co-created with a professor I know, which again fosters those professor-student dynamics, where we talk about cultural competence and why curriculum change is necessary. Then it was highlighted in the media, so this was included in public health initiatives, especially within the BBC and LBC, which was an incredible feat because I think I sometimes feel like with my advocacy, you kind of feel like you're already preaching to people who already know about representation. So actually breaking through these spaces, especially around BBC and LBC, I was able to actually raise awareness within communities and populations that potentially didn't think about representation and the impact it's had on patient care. Then it was after a few successful conversations with PBL leads, it was actually integrated within the PBL curriculum as a recommended reading resource, especially when looking at dermatological case studies such as chickenpox. It was then included in the BMA magazine, which again was incredible. And after presenting at national and international conferences, I was able to be recognized within the US as one of the first British medical students to win the Racial Justice in Medicine Award. And for me, I don't really consider that award as like a, I've done something incredible. It's very much about people want the momentum around representation to continue. And by recognizing the work I've done, I hope that it's very much inspired other people to pursue any forms of initiatives and networks and non-for-profits that they want to carry out, which very much will impact curriculum change and student perspectives and perceptions when it comes to representation. So what else can we do? This is the question that I think a lot of people ask. We've already got these structures in place. We've already started these conversations. What else is left? Well, for me, I think there's a lot left. And these are the four main components of what I think we should do as students and as academics within an educational setting, especially a higher educational setting, to improve racial representation and ethnic minority voices. So grassroots initiatives, I think universities and especially professors and academics should very much foster grassroots initiatives with students. If they have an idea, grow that seed, make sure that they get the support, whether that's financial support, presentation exposure, integration into curriculums. I think all of that really works well in terms of improving the confidence level and the impact that student initiatives may have within education. Conversations. One of my biggest recommendations is using clinical skills time to talk about cultural competence and how you can converse with different ethnic minority groups. Again, when it comes to conversations and communication in medicine, it kind of seems like one size fits all with a lot of it our teaching. So being able to understand what language we can use, what biases that we may potentially be exercising, and what kind of cultural competence is relevant when we're treating our diverse populations, I think will be so, so fruitful. And then we've got research. I think it's really important that we involve students and professors in ethnic minority health research and encourage data collection in the community. And I think it creates a perfect space for feedback as well, not only from that community, but from students as well, as around how much they get involved in research and how much data collection is is included in the curriculum and how much they can actually make a change through these studies and through these papers. And then finally, feedback. I say this so often, but the whole point of healthcare is that, it's a user service. People are using it as a service, and there's no point in us claiming that we're growing or we're improving without using that feedback. So I think getting students involved in conversations and presentations with our patient populations and getting feedback about how they feel about certain experiences, how they feel about certain conversations, how they feel about certain dynamics within the hospital will very much prime students to address every single population when they finally enter placement or when they finally start their foundation training. I think it's so, so fruitful. And I think it's an incredible opportunity for students to communicate with patients as well, because I think for a lot of universities, especially ones that aren't very much like Exeter with the integrated placement lecture structure, students are sheltered behind, lectures and behind classrooms and behind case studies. So they really need to be on the ground talking to these patients about their personal experiences. So finally, how can we foster student-professor dynamics? I think it's so, so important that we do talk about this, because change can only be made when everyone who is involved in the system is involved and is involved actively. So this is a picture that I took, well, I didn't take, but this is a picture that we took at the recent Decolonizing Healthcare and Medicine conference that was carried out a couple of weeks ago. It was carried out by me and a few other amazing medical students with some incredible EDI leaders and academics within the university. And this is kind of what I've learned from it. Having an open dialogue and discussion with these professors is so, so impactful, because it means you're able to share your experience as as a student or as an ethnic minority student with these professors, and see if you can find those synergies or that relevancy with them. Then you've got cultural competence training. I think this is so sustainable, especially for medical students, just revisiting why they say certain things or how they can communicate certain things within different cultural settings. Then critical pedagogy. When we're talking about this, I think I refer to the curriculum that was carried out by Dr. Maisha Reza within the medical sciences degree, and unfortunately is not present within the medical degree. But this is about questioning current structures and questioning current systems in place when it comes to medicine and health. And I think it's so, so important that you have students that do question things and don't just take things at face value. And it fosters that critical thinking that I really think fosters a open mindset and a mindset that really wants to make a change within the university, but then also society wide. And you're creating students that are real change makers. Mentorship programs, I've mentioned before with what already exists, but having mentors there to support students, especially those from ethnic minority backgrounds, will highlight the fact that those structures aren't really in place when you're looking at these bigger systems, and making sure that we have universities that offer those mentorship programs would be incredible. I know currently at the university we do offer a mentorship program, especially with Black and minority ethnic students. But again, I think that needs to be a lot more normalized, and I think a lot more people need to know about it. Co-creation, so using the conference as an example, co-creating certain initiatives, co-creating certain projects, conferences, papers, things like that will foster a very productive and I think sustainable relationship between students and professors in higher education. Another example would be when I created my article with Dr. Maisha Reza. We co-created something that I think is an incredible tool for students and professors alike to see why cultural competence and representation is so important within Times Higher Education. Feedback mechanisms, again, having students say, I don't find this useful, or I find this useful, or I don't find this comfortable, I find this comfortable within the curriculum is so important in order to enact change in the long term. So for example, I know MedRace, they talked about their experiences in surgery, and within the Sikh population, there is a certain bracelet that they wear that is very much, sacred to their lifestyles, and they were essentially told to take it off if they wanted to pursue a career in surgery. So they created a paper on it, and they talked about student experiences and how the professors reacted to that. So again, highlighting those feedback mechanisms to make a change is so, so important. It empowers students as well. If you feel like in your university you're able to make a change and you'll be heard and you'll be listened to and you'll be encouraged, more and more students are able to carry out whatever initiatives they want to carry out, and they're able to have those conversations that they may previously not have felt comfortable to carry out. And leadership, I think having student professor dynamics very much fosters leadership, as this delegation between the student and the professor can create a really lovely environment, as we saw with the conference as an example, where students can take on those leadership roles and professors can learn from students just as much as students can learn from professors. So finally, what legacy can we leave for future medical students and professionals? We've talked about what we can do currently or what we can do in the future, but what happens when, medical students become doctors? What happens when doctors progress up and, they don't have the capacity to get involved in opportunities like this anymore? What happens when people leave the medical profession? What legacy are we leaving? And I think the legacy can be very much boiled down to these 5 stages of support systems and mentorships. Having those normalized mentorship schemes and support systems in place within higher education means that you can continue the conversation around student well-being and safety, especially when it comes to ethnic minority representation. Education and curriculum, if we make that systemic change within the curriculum and education, like including recommended reading, like including conversations for cultural competency within clinical skills, I think it will have a huge long-term impact. Visibility and role models. I've got so many role models within the university who are involved in EDI, but I think priming the next generation of role models and highlighting that visibility of, ethnic minority representation in faculty and staff and students, and especially senior students as well, will very much leave a good legacy for future first and second years. Policy and advocacy, it kind of works hand in hand with curriculum change, but actually highlighting the policy changes that need to be underway, especially when it concerns, the Medical Students Council, and how how much emphasis they're putting on the use of language, how much emphasis are they putting on communication skills within the medical curriculum, will be incredibly interesting to understand, but then also fruitful when you want to potentially make those changes. And then cultural competency training. Again, I think the new bystander training that was introduced to Exeter has been so impactful when it comes to highlighting microaggressions and priming students for holding people accountable. And I think having cultural competency training, all those training modules in place, will ensure that students don't forget about how important uh, thinking about other populations is, and thinking about how important representation is when they're carrying out their medical studies. Thank you so much for listening to this. It was a little shorter than I thought it would be, but I thought it would be a short and sweet lecture to talk about representation and my experiences as a medical student. So these are my references, and hopefully when the recording comes out, you're able to just look at all of these and engage with them if you feel like something resounded with you in this presentation. Thank you so much.